Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3, and welcome to this edition of Dental Sleep Medicine Insider Magazine. Today I'm going to talk about the liners that I use in my dental sleep devices. I typically use one of three liners depending on the patient. The first one is acrylic, so we'll oftentimes just make our devices out of all acrylic. The advantage to this is it's the same material all the way through, and we can make the devices thinner if need be. With the acrylic, we can either add ball clasps for retention. That way we can make the devices tighter or looser. But the negative to those ball clasps is they can bend, break, or even cause tooth movement. So acrylic's a great choice for most offices because you're familiar with it. You have acrylic there in your office if you want to add to a device that maybe had a repair or something. And we're really very familiar with it in our offices. The second material that I use quite often is a flexible liner material. This material is often used in some hard, soft bite guards. It's kind of the spongy, rubbery material that some of you may have used in other devices. The advantage to this material is it's comfortable. Most patients really like it. When it goes in, it kind of has a little cushion, and it also goes around undercuts quite readily. So if you have diverging teeth or big undercuts, this material works great. It's my material of choice for patients who I think are going to be picky about wearing the device. The negative is it's tough to adjust. Many of you have tried to use burrs on this. You can use knives, but it can gum up your burrs and it can be very difficult to adjust. It can also delaminate or discolor over time. And lastly, it can actually lead to more tooth movements in some cases because we can't control the forces that are being put on the teeth as this material is kind of squishing around in the devices themselves. The last material is one of my favorites that I use quite often as well, and that's DSM. DSM goes by other names such as AccuFit, but what it is a heat-sensitive acrylic that as we heat it up, it becomes just like we mixed acrylic again. And the big advantage of this is adjustability. If you have a patient who had a crown done after you've given them the device, then all you have to do is heat up that portion and you can refit this quite readily. If you're having difficulty getting impressions or if the patient's going to be going through some dental work while you're treating them, then you can refit this as many times as you want. You can also make the material fit tighter or looser depending on how long you leave it in the mouth as it's cooling. But be careful not to leave it in too long. So DSM is great in many ways. The negative is it's not as nice of material from an aesthetic point of view. You can't get it as polished as smoothly. It will stain and discolor over time, and it doesn't actually bond to the acrylic really well. So sometimes you'll even get a line of discoloration or even roughness where the two materials meet. So those are the three materials that I use on a regular basis in my office. Each one has its own unique place. I hope this has been beneficial. Thanks for viewing and watching this video in Dental Sleep Medicine Insider Magazine. And again, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3.